Hello, welcome to our case study of designing COVID Alert New York. COVID Alert New York is a mobile phone app that sends alerts if you have been in close proximity to someone who tested positive for COVID-19. A multidisciplinary team of volunteers collaborated with New York State to design COVID Alert New York. The paper tells 6 stories that convey some of the lessons we learned about conducting usability studies during a pandemic. This short video gives you an overview and tells 2 of those stories. While staying safe from COVID-19, we conducted 13 studies using 5 UX methods with over 1,000 participants in 10 weeks. These studies revealed over 150 usability and attitudinal issues, many of which were addressed before the app launched in October 2020. When we joined the project in July, New York State had contracted with a firm that had released a COVID tracking app in Ireland, but there was a lot to do to make it work in New York State. Things like integration with the New York State Department of Health databases, software security checks, the creation of a public ad campaign, and political agreements with neighboring states. Because every day the app was not out to residents could mean lives and livelihoods lost, we worked in parallel with those activities and adopted the design principle, UX never holds up the release of the app. When you look back at the timeline, it looks like we planned a series of complementary evaluation methods, but that's 2020 hindsight. In reality, each decision of what to do next was very in the moment. So let's start with that first moment when 3 UX practitioners came together as volunteers to design the UI for New York State. We thought we only had 2 or 3 weeks to make any changes at all to the UI. Therefore, we needed to start evaluation and get results fast. We were also in the midst of the pandemic and needed to avoid contact with users. We needed a proven method for assessing the usability of walk-up and use systems. Luckily, there is such a method called cognitive walkthrough, so we started immediately evaluating the existing Irish app using this method. Cognitive walkthrough doesn't require users. You examine each screen in the app, asking 4 questions about the user's goals, what they see, what they understand, and the feedback they get after taking an action. If any of these fail, then you consider redesigning the screen. As an example, let's assume a 15-year-old wants to help her grandmother use this app and downloads it to check it out. She gets this screen and taps, "I am under 16." The app does not let her continue. So, for Cognitive Walkthrough's questions, the action is visible, the action's label is clear, the feedback is understandable, but the app's flow is not aligned with her goal of helping her grandmother. By focusing us on the user's goals, Cognitive Walkthrough helped us think about other reasons minors might want to have the app working on their phone. For instance, New York State was preparing to open schools, and many parents would want their children to have this app. So we collaborated with New York State lawyers to come up with wording that would allow these goals to be met. A parent or guardian could now confirm the use of the app on a minor's phone. Other onboarding steps also did not support the user's goals well. In response, we were able to reduce the screens required to onboard from 9 to 5 and substantially reduce the amount of text on those screens. At this point, we were told that we had another week or 2 before the app could launch, so we could continue UX research and design. Although we still needed to be safe during the pandemic, the design team wanted to test the new designs with real users. So we did what's known as guerrilla usability testing, where you do scrappy testing with whomever you can get with whatever materials you have access to. I had access to people because I live near Central Park in New York City, and enjoying the park was allowed even under lockdown regulations. While I couldn't hand the participants a phone or tablet, since no one would want to touch something I had touched, I might be able to show people pieces of paper with screens printed on them. So this was my pandemic protocol. I wore a mask and face shield and positioned the participant 6 feet from me on a park bench. My lovely canine assistant made sure that the participant stayed 6 feet away. I held up a piece of paper with a screen printed on it and asked the participant what he would do, then held up the next screen, depending on what he answered. I ran 11 participants over 3 sunny and hot days in Central Park, 7 with version 1 of the app, 4 with version 2. I used visual note-taking to make this as effective and efficient as possible. I printed thumbnails of the screens and could circle and jot down the participants' answers very quickly. Almost half of the people seeing version 1 feared that they would get too many alerts from passers-by. In response, we changed version 1's explanation of the technology to a how it works animation that emphasized both time and distance. This leaves us in the middle of August. Delays in some of the other streams of work allowed us to do 10 additional studies with 3 other methods before we launched on October 1st. Please read the paper to find our other stories. Thank you, and stay safe.